A very good day to all of you. I'm Dr. Mayuri Trivedi. I am the consultant nephrologist and the head of Department of Nephrology at the LTMGH Hospital in Mumbai. Today, I'm going to, in the next 15 minutes or so, discuss three important questions which always are an issue for most patients with kidney disease. The first question that I'm going to discuss today is that when CKD is growing due to unmanaged diabetes and blood pressure, are patients alerted about kidney disease which is looming at large? We need to understand that many chronic diseases like hypertension, that is high blood pressure, diabetes, etc., are risk factors for chronic kidney disease. And at present, because of various factors, including our lifestyle issues, the genetic issues, pollution, we have a lot of patients who are now presenting with diseases, metabolic diseases like diabetes and hypertension. And when a patient presents to us with conditions like diabetes, blood pressures, it is our duty to alert the patient that these are risk factors for chronic disease, chronic kidney disease, and they need to make it a point to screen for these diseases for the rest of their lives. On an average, a patient who's a diabetic for 5 to 8 years or a maximum of 10 years would definitely be at a high risk for developing CKD or diabetic kidney disease. Such patients need to be alerted from day one the importance of controlling their sugars, the importance of taking care of their kidney, the importance of not putting on weight, the importance of not indulging in any high risk behavior which may cause the kidney to give a problem in the future. The fact that they have diabetes or hypertension as a risk factor already makes it even more important for these patients not to indulge in any high risk behavior. The next question that I'm going to deal with today is that sometimes the patients come to us during the later stages of kidney disease where we may not be able to really diagnose the cause of kidney disease and what are the treatment options that we can offer at that point of time. So before I actually discuss this question, one needs to understand that the endpoint of any kidney disease, anything that causes a kidney disease, is CKD and kidney failure. There are 100 reasons why a kidney may fail or why a kidney may get diseased. All of them towards the end always cause the same thing, that is kidney failure or CKD. If you come to a doctor during your last stages, so when I say last stages of kidney diseases, when your creats are really high, though there is no definite number that where I can say that 3 is high and 5 is not high, or 5 is high and 3 is not high, but if you the later you present to a specialist, lesser is the chances that we may be able to give you an answer as to why your kidneys actually got spoiled. So you may have seen your doctor sometimes telling you that we don't know what the NKD is or what the native kidney disease is. So the native kidney disease means that what actually caused your kidneys to fail. And at this point of time, the later you come during your disease process, lesser is the chance that the doctor will indulge in what is called as a biopsy, that is, removing a piece of your kidney and to see it under the microscope to actually give you an answer as to why the kidneys actually failed. So if you come during the later part of the disease or later to the doctor, we are not able to biopsy the patient and we may not be able to give you an answer. The second part to this question is that we may not be able to even offer you any treatment to reverse the process. The later you come to us, lesser is the chance that we may be able to give you some treatment for reversing your disease. So it may be that if you come early to us, a patient comes earlier to us, and even a creat of 5, 6, 7, 8, anything, we can offer treatment and they may revert back to normal, or their creats may fall down. But the later in the disease that you come, there is more chronicity of the disease, and lesser is the chance that we will be able to offer you treatment. Actually, at this point of time, if you offer treatment, it might be hazardous to you, because some of the drugs that are given to reverse kidney disease are not safe for the patient if the creats are very high. So the gist of the this question would be that when you have symptoms of kidney disease, which are supposed to be the symptoms of kidney disease, you may not have kidney disease, but if you have symptoms like urinary problem, like having blood in the urine, like having protein in the urine, like you are having any burning or pain while passing urine, or there is decreased urine output, you are having swelling of the body, swelling of the feet, go to a doctor and try and get your kidneys checked at that point of time. Because remember, the earlier you go to a doctor, the earlier you are screened, the earlier you are screened, the earlier you are diagnosed, and earlier you are diagnosed, early can we give you treatment. The later you go to a doctor, lesser is the chance that he will biopsy, and probably much lesser is the chance that he will be able to offer you any treatment for the kidney disease that you have. The third question that I was asked to actually discuss was that do we do dietary counseling in patients with diabetic kidney disease, which is also called as diabetic nephropathy, as compared to the patients who just have plain diabetes. So as I said during the early part of my talk, that a patient who comes to us with diabetes without kidney disease, just plain diabetes, in the back of our minds, we know that this patient is at a high risk for a kidney disease. So from the day one, it is very imperative that you follow a strict diet, that so that you don't go on to lead to become a diabetic kidney disease, so that diabetes does not affect your kidneys. So the diet counseling is not very difficult. All we tell the patient is that control your sugars, so that remains constant for every patient, whether you have a kidney disease or you don't have a kidney disease. Controlling the sugar is something that is very necessary, because tight controls of sugars are required for your heart health, they are required for your eye health, they are required for your kidney health. So it is in your best interest that the sugars are controlled, and you have sugar appropriate diets, so that you don't have too many carbohydrates and your sugars go high. Apart from that, we also advise the patients during the early stages, when the patient is just a diabetic, or whether he has diabetic nephropathy, that you need to counsel them very strictly to have less salt. Because salt is something that will affect the kidney in the long run. So wherein we don't say that you stop salt, but you have to reduce the amount of salt that you take, because excess of salt is handled by the kidney, and the more the salt you take, more is the damage that you are going to give a kidney which is already a diabetic, which wherein the patient already has diabetes. So the second dietary counseling that we strictly follow is to have a tight salt control for these patients. The other thing we need to remember is most of these diabetic patients also have blood pressure, and for that also they need to control the salt. Now, should you be a patient who has diabetic kidney disease and not just plain diabetes, then in that case, you will have to control the amount of protein, especially the amount of animal protein that you take. Should you not have a kidney disease, then we do not really restrict proteins in these patients. But if you have developed early kidney disease, then it is imperative that you take lesser amounts of proteins. But at the same time, there is a myth in society that once you have kidney disease, protein ban kar dena hai. It is not like that. You don't have to stop proteins. You have to control proteins, especially animal proteins. And it would be the best that you do your dietary modifications under the supervision of a qualified doctor, rather than just listening to your WhatsApp and listening to social media and listening to Bajuwali auntie and Bajuwali uncle who told you ki protein ban kar dena hai. Remember, protein band nahi karna hai. You have to reduce the amount of protein you take, especially the amount of animal protein that you take. But I would again advise you that you need to go to a doctor and get treated for your diet, or the diet advice has to be given by an expert, not by WhatsApp, not by social media, and not by your neighbors and aunties and uncles for sure. So in the end, all I want to say is that take care, the early screening, and a strict disciplined life when you are diagnosed with diabetes or blood pressure will definitely help you to keep away from kidney disease. And in case you have early kidney disease, it will definitely help you delay kidney failure. So prevention is always better than cure. Thank you so much.